I'm Orlando Landrum, the president and CEO of Cutting Edge Integrative Pain Centers. I'm an integrative pain physician as well as a regenerative medicine specialist. So what that entails is, as an integrative pain physician, we treat back, knee, hip, and other areas of the body. And as a regenerative medicine specialist, we provide treatment that allows patients another alternative other than surgery. As a doctor, I take things personally because I never really wanted to be a doctor as a child. Really, the reason why I became a doc is because my father, who had a stroke, we interacted with physicians that really had no heart and no care for the person that they were treating. They never looked up for their chart. They never talked to us, never looked us in the eye. And I attempt to be able to do exactly the opposite of that. So when a patient comes in to see me, the very first thing I want to know is their why. Why are they coming to me? And how can we be able to make sure that that stays as our first and foremost objective to be able to treat? So initially when a patient comes to see me, I want to hear their story. At Cutting Edge Integrative Pain Centers, one of the reasons why I developed a practice to begin with is we didn't want to put profits before patients. Basically what we said is we're not trying to do the same thing over and over again to basically put patients back through the same rinse and repeat type episode. What we're looking to do is to find a way to be able to treat them, to be able to provide success that allows them to live their lives that like they would want to live them, the same way as if it was me, the same way if it was my family. And so what we said is, how can we get off our laurels? How can we get off of being comfortable and find a way to be able to make that patient better, even if it means we have to kind of test our boundaries to be able to push towards those cutting edge techniques. And so that's what we did. We found a way to be able to look at neuromodulation, ways to be able to influence how you feel, how your nerves process information and be able to provide that techniques. We looked at structural issues as opposed to going after traditional surgery and saying, hey, we need to introduce new artificial joints or introduce metal into the body. Can we be able to use our native natural tissue to be able to do those type of things, to be able to provide structural relief and stability? And we looked at the elements of saying, how can we be able to treat minimally invasively tissues that needed to be removed in a manner without having to do a huge, big surgery. That's what makes us unique. That's what makes us different. And that's what we provide to patients.